Universal healthcare in the United States of America, a healthy debate. Number 1. Introduction. Healthcare is one of the most significant socio-political topics in the United States, U.S., and citizens currently rank healthcare as the most important issue when it comes to voting. 1. The U.S. has historically utilized a mixed public/private approach to healthcare. In this approach, citizens or businesses can obtain health insurance from private, example, Blue Cross Blue Shield, Kaiser Permanente, insurance companies, while individuals may also qualify for public, example, Medicaid, Medicare, Veterans Affairs, government-subsidized health insurance. In contrast, the vast majority of post-industrial, westernized nations have used various approaches to provide entirely or largely governmentally subsidized, universal healthcare to all citizens regardless of socio-economic status, SES, employment status, or ability to pay. The World Health Organization defines universal healthcare as ensuring that all people have access to needed health services, including prevention, promotion, treatment, rehabilitation and palliation of sufficient quality to be effective while also ensuring that the use of these services does not expose the user to financial hardship. 2. Importantly, the Obama-era passage of the Affordable Care Act, ACA, sought to move the U.S. closer to universal healthcare by expanding health coverage for millions of Americans, example, via Medicaid expansion, launch of health insurance marketplaces for private coverage, including for citizens across income levels, age, race, and ethnicity. Differing versions of universal healthcare are possible. The United Kingdom's National Health Services can be considered a fairly traditional version of universal healthcare with few options for, and minimal use of, privatized care. 3. On the other hand, European countries like Switzerland, the Netherlands, and Germany have utilized a blended system with substantial government and market-based components. 4. 5. For example, Germany uses a multi-payer healthcare system in which subsidized healthcare is widely available for low-income citizens, yet private options, which provide the same quality and level of care as the subsidized option, are also available to higher-income individuals. Thus, universal healthcare does not necessarily preclude the role of private providers within the healthcare system, but rather ensures that equity and effectiveness of care at population and individual levels are a reference and expectation for the system as a whole. In line with this, versions of universal healthcare have been implemented by countries with diverse political backgrounds, example, not limited to traditionally socialist/liberal countries, including some with very high degrees of economic freedom. 6. 7. Determining the degree to which a nation's healthcare is universal is complex and is not a black and white issue. For example, government backing, public will, and basic financing structure, among many other factors, must be extensively considered. While an in-depth analysis of each of these factors is beyond the scope of this commentary, there are clear advantages and disadvantages to purely private, market-based, and governmental, universal approaches to healthcare, as well as for policies that lie somewhere in between. This opinion piece will highlight arguments for and against universal healthcare in the U.S., followed by the author's stance on this issue and concluding remarks. Number 2. Argument against universal healthcare. Though the majority of post-industrial westernized nations employ a universal healthcare model, few, if any, of these nations are as geographically large, populous, or ethnically/racially diverse as the U.S. Different regions in the U.S. are defined by distinct cultural identities, citizens have unique religious and political values, and the populace spans the socio-economic spectrum. Moreover, heterogeneous climates and population densities confer different health needs and challenges across the U.S. 8. Thus, critics of universal healthcare in the U.S. argue that implementation would not be as feasible, organizationally or financially, as other developed nations. 9. There is indeed agreement that realization of universal healthcare in the U.S. would necessitate significant upfront costs. 10. These costs would include those related to physical and technological infrastructural changes to the healthcare system, including at the government level, i.e., federal, state, local, as well as the level of the provider, example, hospital, outpatient clinic, pharmacy, etc. 2. Insuring/treating a significant, previously uninsured, and largely unhealthy segment of the population, and 3. Expansion of the range of services provided, example, dental, vision, hearing. 10. The cost of a universal healthcare system would depend on its structure, benefit levels, and extent of coverage. However, most proposals would entail increased federal taxes, at least for higher earners. 4, 11, 12. One proposal for universal healthcare recently pushed included options such as a 7.5% payroll tax plus a 4% income tax on all Americans, with higher income citizens subjected to higher taxes. 13. However, outside projections suggest that these tax proposals would not be sufficient to fund this plan. In terms of the national economic toll, cost estimations of this proposal range from $32 to $44 trillion across 10 years, while deficit estimations range from $1.1 to $2.1 trillion per year. 14. Beyond individual and federal costs, other common arguments against universal healthcare include the potential for general system inefficiency, including lengthy wait times for patients and a hampering of medical entrepreneurship and innovation. 3, 12, 15, 16. Such critiques are not new, as exemplified by rhetoric surrounding the Clinton administration's Health Security Act, which was labeled as government meddling in medical care that would result in big government inefficiency. 12, 15. The ACA has been met with similar resistance and bombast, example, the repeal and replace right-leaning rallying cry, as a result of perceived inefficiency and unwanted government involvement. As an example of lengthy wait times associated with universal coverage, in 2017 Canadians were on waiting lists for an estimated 1,040,791 procedures, and the median wait time for arthroplasty surgery was 20 to 52 weeks. 17. Similarly, average waiting time for elective hospital-based care in the United Kingdom is 46 days, while some patients wait over a year. 3. Increased wait times in the U.S. would likely occur, at least in the short term, as a result of a steep rise in the number of primary and emergency care visits, due to eliminating the financial barrier to seek care, as well as general wastefulness, inefficiency, and disorganization that is often associated with bureaucratic, government-run agencies.